name is Eric Curtis, and I will be performing a musculoskeletal exam for Nursing 383. I'll begin the exam by washing my hands, introducing myself to the patient, and providing a brief explanation to her of the exam. I'm going to begin by doing an overall general assessment. I can see that she's holding her posture well. She appears to be well nourished, well hydrated, does not appear to be in any acute distress. In speaking with her, I can tell that her speech is clear and comprehensible, that she is well oriented and alert. She is appropriately dressed for the time of weather and the season, and so we'll begin our exam of the upper extremities, and typically we would have each extremity exposed for direct visualization. For the purpose of this assignment, though, we will skip that portion. So we'll begin by inspecting each extremity. We're going to note skin color, any variations and changes of skin color, presence of skin lesions, obvious joint deformities or masses. We'll begin with palpation on the top of the shoulder. You can palpate on the top and feel the acromioclavicular joint, and then you can move outward to the acromion process, and then as you can locate the humeral head. And then you palpate around on either side of the joint, and at that time you're going to note any nonverbal cues elicited by the patient as far as guarding or wincing that may be an indicator of pain. Moving on down the arm, we'll palpate the upper arm, noting the presence of any masses, appropriate muscle mass, detecting any presence of any atrophy. Get to the elbow, you can palpate the olecranon, the lateral and medial epicondyles, palpate the anacube, again noticing any tenderness, any joint deformities that lie in there. Moving down the lower arm, again going to palpate, noting the appropriate muscle mass, presence of any lesions. Get to the wrist, and you can palpate the ulnar head, and then the radius on the other side. Palpate the back of the hand, fingers, palm, and again we're going to note, as we palpate, we'll be noting any skin temperature changes from top to bottom. And we're going to want to do that on the opposite side as well. For the sake of time, I won't go completely through the whole process, but we'll be noting symmetry from side to side as far as skin temperature and presence of any masses, joint deformities, and such. At that point, we will do some range of motion. I'll have you slide to the front of the seat a little bit. And we're going to check, on range of motion, we'll check for symmetry side to side, noting the ease of movement, the muscle coordination, presence of any guarding or grimacing that may occur as a sign of pain. So we'll start, I'll have you just kind of follow my motions. We'll go up and over, nice and slow. Okay, good. And then down in front. Okay, good. Then we'll come straight up, and we will adduct. Good. And we will abduct. Okay, good. And then we'll come up behind the back. Good. And we'll go up and we'll go over behind the head. Good. Okay. So her coordination and ease of movement was pretty good. Typically we give her 5 out of 5 for adequate range of motion. That's within defined limits. So I'll have her now, we'll test a little bit of strength. I'll have you hold your arms straight up. And then I don't want you to let me push against your arms. Okay, good. Don't let me pull. Good. Don't let me push on your elbows. Good. Don't let me push out. Good. Okay. And then for wrist strength, we'll do that at this time. From the wrist up, don't let me push against your fingertips. Good. Or pull. Good. Okay. So then we'll go hands straight out. Okay. We'll do range of motion on the wrist at this time. So I have you flex both wrists down. And you go both wrists up, and then round and round with both wrists. Good. Then I'll have you stand straight out, make me a fist, and then extend. Okay. Range of motion of the hands and fingers is, and the wrists are all within defined 5 out of 5. Strength-wise, I don't want you to let me close your fingers. Good. Close your fingers for me. Don't let me open them. Okay, good. Alright, you can let your hands down. So her strength in the upper extremities is appropriate as well. Next thing we check on the upper extremities would be the pulses. So we'll begin with the radial pulse, and we will check these pulses for rate, rhythm, and strength. And normal pulse would be a +2. We'll check both sides, and we'll be checking for symmetry, any deviation from side to side. If the need arises, you can also check an ulnar pulse. They are a little more difficult to find than the radial, but we check those also bilaterally. And then we check a brachial pulse on the anticube. And again, we're checking for that rate, rhythm, and strength, and looking for a normal pulse at +2. Okay, good. That concludes the portion of the upper extremities, so we'll move on to the lower extremity exam. And again, typically we'd have the lower extremities exposed. We would visualize noting any skin color changes. That would be typically present in the lower extremities if there was any arterial or venous deficiencies present. We're going to inspect for any obvious skin lesions, any obvious joint deformities, and that kind of thing. Begin by palpating the upper leg, noting any deep masses that may be present. Get to the knee, get your medial and lateral aspects of the knee, the popliteal, and the kneecap. And again, you're observing the patient for any nonverbal signs of pain, grimacing or guarding of such. I'm going to palpate the back of the calf, particularly noting for color or temperature change, any tenderness that may be there. Palpate the anterior aspect of the leg down to the ankle, to your medial and lateral malleolus, and we'll palpate the calcaneus, and then kind of the upper, the top and bottom of the foot at the same time, and then the toes. And so we would do the same palpation inspection on the opposite leg, again noting any deformities or masses or pain elicitation, skin lesions, and the such. So we will check her lower extremity, her ankle range of motion. So I'll have you extend your foot down, and then we'll flex it back, and then round and round, and then the same on the other side. Flex down, or extend down, flex up, and rotate. Okay, good. And then, so again, her range of motion is a 5 out of 5, and symmetry is bilateral within defined limits. So we'll test strength of the lower extremities, and I'll begin, and so we'll have, don't let me push in on your legs. Okay, good. Don't let me pull back. Good. Don't let me push in on your knees. Over, out. Okay, good. And with your feet straight up, don't let me push up. Don't let me push down on your toes. Okay. Don't let me push in. And don't let me push out. Okay, good. So the strength in her lower extremities is symmetrical. You're checking for any deviation side to side, picking up on any potential slight differentiation between strength of the lower extremities. Next thing, while she's sitting here, I want to palpate her pulses on both legs. So we'll start with the popliteal on one side, and again we're checking for that rate, rhythm, and strength. And typically the normal pulse is +2. So you check side to side for symmetry. And then we have the posterior tibial pulse, an inner aspect of the foot between the medial malleolus and the calcaneus. We're checking bilaterally again for symmetry. And then the dorsalis pedis on the top of the foot, bilaterally. Okay, and again checking for any deviation in symmetry and strength of those. Last thing I want to check on our ankles would be the presence of any edema. And so I typically palpate and hold for about 10 seconds, and then release that. And if there's any indentation left in the skin or tissue, then that could be rated anywhere from trace to +4 pitting edema. And you would do that on both sides, as well as up the calf if indicated. So we'll finish up the lower extremity exam. I'll have her jump off the stool and stand for me. And then with your back straight, I'm just going to have you kind of dip your knees. Okay, good. And then I'll have you extend back, and then extend forward at the waist. Okay, good. And then go side to side. Okay, good. And then rotate. Good. And then we'll finish up. I'll have you bend over and touch your toes and hold for a second. And at this time we can palpate up the spine, and you can note any incorrect curvature that may be there. You can note the spinal processes and detect any masses or presence of tenderness that may be there. You can go ahead and sit down if you like. So that concludes my lower extremity assessment. Generally we would do a hip exam in the musculoskeletal, but I will do that in the next video with the abdominal assessment, as I will have her supine for that exam. So I will conclude by washing my hands and thanking my patient, my wife, and thank you.